Hi, I'm Chris LeBlanc, Czech practitioner and holistic lifestyle coach, and welcome to another Chi Training Studio workout tip. Today, I'd like to talk about your butt and if it's functional. There's a high occurrence of dysfunction in people's glutes today. It's what my mentor Paul Czech calls the heart bottom syndrome. I just have a little picture over here to show you. So on this picture, you can see why it's called a heart bottom syndrome. We have, sorry about that. We have a normal person over here. And what you're going to see is the majority of their muscle mass is found in their glute max, or around their gluteal fold where your butt meets your hamstring. And it virtually makes an inverted heart because it starts to thin out in the muscle mass as it makes your way up to your low back. Conversely, on the dysfunctional side, what you're going to see is a large amount of the muscle mass is found in the upper sides, which are the glute medius. And they get really thinned out. You can almost see there's no cheek showing here, gluteal fold. They really thin out as they make their way down to your bottom. This dysfunctional pattern occurs from a list of reasons, but some very popular ones. People have a lot of digestive inflammation, which turns off this and makes these guys have to brace. They get back pain or an acute injury. Another very common one, and important one, is any lady that has been pregnant. What happens, there's a lot of damage done to the pelvic floor during pregnancy, and as soon as there's damage, we know there's pain associated with it, and we know when there's pain, everything on that neural pathway of the spine, it gets what we call inhibited, or virtually has all the muscles turn off. They can't fire correctly. And so what has to happen is a faulty recruitment pattern takes over, and the glute mid starts to help to stabilize. It starts taking over the role of what the pelvic floor is supposed to do, and it starts engaging all sorts of times to help stabilize that low back. And unfortunately, the muscle becomes what we call hyper-responsive, so it's there quite often when it shouldn't be, and the more and more we start in training this, we have the path of least resistance, and it starts taking over for all actions, and it starts bypassing your glute max. And it starts doing a whole bunch of movements it's not really intended to do. And what happens is you start getting that atrophy or that shrinking of the muscle mass because this is no longer working. Kind of like if you have your arm in a cast, you get it out of the cast 6 weeks later, there's really not too much muscle around there. That's virtually what your glute max is sedated. It's like being in a cast, and boom, there's no muscle mass left over. So if you think you're suffering from a heart bottom syndrome, there's a couple things you can do to rectify the situation. First is to seek out a great massage therapist that does pelvic floor work, and they can work on some adhesions or improve that tissue quality. Secondly, you can start actually doing retraining exercises or corrective exercises to get that pelvic floor going. And ones that are great is anything tied in with the belly button muscle, your transverse abdominal, or your TVA. They're on the same spinal segment or on the same communication wave. So I'm going to actually show you one today. It's called your 4-point tummy vacuum, and we're just going to get down on the floor. And the 4 points just means we're going to have our hands and our knees down on the floor. We're going to have our wrist and our shoulder in a nice perpendicular line. So you can use, I just have a little bell rod here. You can use a broomstick, a foam roller, anything that's nice and straight. So again, you're going to have your knee and your hip in a nice vertical line here. And once you're done that, you're just going to throw this dowel rod on your back. We're going to get some nice posture going here. So the thickest part of your palm should get stuck between your spine and the dowel rod. And then the little bump on your back of your head, your occipital notch, should be touching your dowel rod. Okay, so that's the start up. All this one is going to require you to do is take a nice, full, deep diaphragmatic breath. So we're going to be expanding that belly, filling up the balloon, I like to say. And then we're just going to tuck the belly button up towards the spine. So you're going to get your stomach as small as possible, or what I call the beach suck. Pretend you're walking down the beach. Okay, so in real time, it's just going to look like this. We're going to take a nice slow inhale. And just tuck the belly button up without moving any other body part. So without moving your low back or moving your head down. and let the air out. Nice slow inhale. Tuck the belly button up. And exhale. Okay? So you're going to do this 10 times. And all you're going to do is go for the duration of your breath. So if you can breathe for 3 seconds, go for it. You're just trying to hold that on a comfortable pace for yourself. So give that a go. Start teaching your body on how to fire the correct muscles, and you'll start having a healthy butt in no time. Until next time, with Chi.